Have you ever done everything you were told to do and still felt let down when it mattered most? You made plans for the night. You took the medicine. You waited. And nothing went the way you wanted, even though you did everything properly. You're not the only one who thinks that. A lot of men over 60 do their hardest, yet still have trouble. You didn't fail. There is a secret factor that most people don't know about. You might be astonished when you see it. Stay with me, because I'll show you a simple repair that seniors may apply and a secret weapon that often transforms the game without even realizing it. Let's give the emotion a name. This problem sneaks up on you without you knowing it. It can happen slowly. Months go by, confidence goes down, you stop being close to others. You don't care, yet the concern comes before the moment. It's also simple to blame oneself, which is worse. Please don't. After age 60, circulation changes. Nerves alter. Meals and medicines are important. You can get large results, good or bad, without even knowing it by making small timing mistakes. If we don't do anything, we can become dependent, which we don't desire. Less activity, more time sitting, more space between you and your spouse. That route can lead to a walker, then a wheelchair, and a life that feels smaller than it should. I'm stating this with care, not fear. What you do next can help keep your independence, vitality, and connections. The underlying adversary is not the medicine itself, but how we use it in real life. A group of mistakes that go unnoticed is to blame. Not the right time. The dose is not right for your body. Big meals that stop the medication from working. Thinking that more is better when it isn't. And not paying attention to adverse effects that could be fixed. The good news is, you can fix these. Small changes assist blood flow to the right places at the right times. Now the authority bridge, promptly and plainly. In a lot of randomized trials, researchers have compared the most prevalent options directly. They looked at 82 trials with more than 47,000 men to examine how effectively these tablets help with erections, and another 72 trials with more than 20,000 men to evaluate how safe they are. The results were the same. All of the typical choices worked better than a sugar pill. Sildenafil 50 mg demonstrated roughly a 47% improvement in erectile function compared to a placebo at normal starting levels. Tadalafil 10 mg worked about 33% better. Vardenafil 10 mg is about 35% effective. About 29% of the time, Avanafil 100 mg. Taking more didn't always help. They sometimes helped the same amount or even a little less, but they also made adverse effects worse. Some people got headaches, flushes, indigestion, and stuffy noses. Tadalafil 10 mg had one of the lowest overall side effect rates in that safety review, while Sildenafil 50 mg had a higher rate of about 18%, and Tadalafil 10 mg had a rate of about 10%. Most people don't know this. The greatest pick isn't always the strongest pill. It's the one that works best for your body, your eating habits, your schedule, and your goals. Let's start the countdown. To avoid the silent errors, we'll start with warnings. After that, we'll talk about options that are good for seniors. And please, stay with me for the #1 adjustment that most seniors don't expect. 8. You should not use these pills with heart drugs that contain nitrates. Problem after 60. Taking nitroglycerin or other nitrates for chest discomfort and an ED tablet at the same time can make your blood pressure drop too low. That could be risky. Science says that these medications make blood vessels bigger. Nitrates also make them bigger. Together, blood pressure can drop quickly. Dizziness is a personal effect. Passing out, falls. In the worst situation, it's an emergency. That puts independence at risk. If your doctor has told you that your heart can't withstand sex, don't take these medications. Don't mix nitrates if you take them. Tell your doctor exactly what you take. Ask about safe options. 9. Avoid heavy, late, high-fat meals and extra drinks. After 60, you finally have a night out. Eat a huge meal, take the pill, and nothing. Science says that food, especially heavy, fatty food, can make some medications take longer to work. Alcohol might make it harder for your brain and body to talk to one another. The result is that you don't get as much blood flow when you need it. Personal effect. You think the medication failed, which makes you less confident. You stop being close to others. Simple step, make a meal plan. A lot of people perform better when they don't eat a big, fatty meal right before taking these drugs. Don't drink too much or skip it. If a medicine's label states food gets in the way, you should listen to that advice. This one change can make the same drug feel very different. What makes it worse is that a lot of men try to fix a sluggish night by doubling up. That brings us to the next mistake. 6. Avoid dose chasing. After 60, you might think, I'll just take more when the results aren't consistent. Science, plain. In the large comparisons, more wasn't always better. In such averages, for instance, sildenafil 100 milligrams did not consistently beat 50 milligrams. Some higher doses caused more side effects without making things better. Personal effects: headache, flushing, upset stomach, and stuffy nose. The next day you feel tired. That can make it harder to walk, keep your balance, and have more energy. Easy step: take the doses your doctor tells you to. Start with the dose that is based on evidence. Make one change at a time. Keep an eye on the results. If a change makes things better, retain it. If not, take a step back. What's worse is that even the appropriate dose can let you down if you don't take it at the right time. 5. Avoid this problem: time that isn't predictable and no plan for arousal. After 60, you take a tablet, just in case, but the moment comes far later or earlier than the pill's curve. You could think the pill will work even if you don't do anything sexual. In simple terms, these drugs help the usual way that blood flows during arousal. They help, but they don't turn on. Some work quickly and then fade away. Some last longer but could take longer to feel. It feels like the medicine didn't work if the time and arousal don't match. Personal effect: windows that were missed. Anger, avoidance. Simple step: be aware of your pattern. If you like to be spontaneous and have a lot of time, one option might be better. If you want to know exactly what you're going to do that night, another one might be perfect. Plan some time for gentle stimulation. It's like turning on a lamp instead of switching a switch. What's worse is that we blame ourselves instead of finding a medicine that works with our lifestyle. So let's look for ways to help people be independent and sure of themselves. 4. Solution: find a drug that works with your way of life. After 60, the wrong fit makes mistakes that go unnoticed. Science, plain and simple. Different medications work at different speeds and for different amounts of time. Some people are more sensitive to food. Some give you more time. Personal impact: if you find the correct fit, you can plan less, relax more, and save your energy and balance for the next day. Simple question: do I want an assistant who can come right away for a prearranged evening? Or do I want a longer time frame that covers a whole day and makes scheduling less stressful? Take that answer to your doctor. Make sure your option fits with how you live. This one choice can make things easier by 50% without increasing the dose. 5. Start with doses that have been shown to work. Here's the twist: the standard start is typically the best one. After 60, people have problems because they start too low or jump too high. In big comparisons, initial doses did better on average. Compared to a placebo, sildenafil 50 milligrams made erectile function better by roughly 47%. Tadalafil 10 milligrams is about 33%. About 35% of the time, vardenafil 10 milligrams. About 29% of avanafil 100 milligrams. Higher doses didn't always lead to greater results. Personal effect: finding the sweet spot cuts down on side effects and keeps your energy up for walking, chores, and balance the next day. If you and your doctor agree on an alternative, ask to start at the dose that has been shown to work. Try it a few times in the same conditions. Keep track of what you ate, when you ate it, and what happened. Take that log with you to your follow-up. Before we proceed any further, let me make it clear that side effects are important and can be handled. 2. When you're sensitive, the best thing to do is to take the path with less negative effects. After 60, headaches, flushing, indigestion, or congestion can make you stop too soon. In plain English, science says that lower initial doses have fewer adverse effects overall when comparing safety. In those big summaries, tadalafil 10 milligrams had one of the lowest overall rates of bad events, while sildenafil 50 milligrams had a higher rate. That doesn't imply one is good and the other is bad. It just means we should choose the solution that works best for you. Personal impact: you are more likely to walk the next day, keep up with your balance training, and stay independent if you have less headache and less hangover feeling. If you're sensitive, talk to your doctor about starting with a dose that has traditionally had fewer side effects and only changing it as needed. The next day, eat light meals, drink a lot of water, and take it easy. Here's another surprise before we get to our number 1 item. Sometimes the answer isn't just one dose. It's a simple thing to do. 1. Grand reveal, your hidden weapon. A steady-state regimen with an on-demand booster and clever meal timing. Do you remember the promise at the beginning? You might be doing practically everything right, but you're making one big mistake. You treat every night as a new experiment. After age 60, your blood flow channel frequently works best with a continuous push. When one-time doses don't work, many doctors use a straightforward approach. They maintain the pathway ready with a modest everyday routine and give a booster when needed for planned intimacy. In practice, this might mean taking a low dose every day. For example, many doctors give their patients 5 milligrams of tadalafil every day to help them stay ready. And then, when needed, taking an on-demand dose chosen with your doctor, like an extra tadalafil dose or a standard starting dose of another option like sildenafil, spaced out and timed safely. That kind of method is employed in evaluations when a single dose doesn't work as well as it should. The answer is simple science in plain English. Supporting the pathway that opens blood vessels makes it easier to activate. Then the booster helps you get through the moment. Personal effect. Evenings are more predictable. Less stress about performance. Less missed windows. Better sleep. Better mood. More walks in the morning. More freedom. It's easy to do this. Bring this identical line to your doctor. If on-demand alone isn't working, can we try a low daily routine with a carefully timed booster on planned days while I follow the meal and alcohol advice? Add this. I'll keep a simple log of dose, time, meal, and result. That partnership turns guessing into a strategy. Let's put it all together with a clear plan of action that you can start immediately, always with the help of your personal clinician. Step 1. Make sure you're safe. Do not use these medications if your doctor has ever told you that your heart can't handle sex, or if you take nitrates for chest pain. Ask about other options. Bring a complete list of all the medications you take to your next appointment. Step 2. Choose your fit. Do you prefer an on-demand option for planned evenings, or a longer coverage window to make scheduling less stressful? Choose the lifestyle that best fits you. Step 3. Get off to a good start. Use initial doses that are backed by evidence. Try each choice a few times under the same conditions to be fair. Don't eat a lot of heavy, fatty foods close to the time you take some medicines. Don't drink too much. Make it exciting. Step 4. Keep an eye on things and make changes. Just write down the date, dose, time, food, result, and side effects on a piece of paper. Take it to your doctor. If side effects are making you slow down, ask about a path with less side effects. Step 5. If necessary, use the steady-state strategy. Talk about a low everyday routine with a planned booster at a specific moment. Do what your doctor says when it comes to time. Keep your log running so you can both see the pattern. You might be saying to yourself, "But I've already tried these." Please, stay with me. Here's the twist. A lot of guys alter too many things at once. New dosage, new food, new time, different expectations. You can't tell what worked anymore. Your log fixes that, and your doctor can utilize it to work with you more closely. Let's quickly go over the important ideas again before we end. Repetition is helpful. In big groups, all common choices are preferable than a sugar pill. At first doses, sildenafil 50 milligrams improved by about 47%, tadalafil 10 milligrams by about 33%, vardenafil 10 milligrams by about 35%, and avanafil 100 milligrams by about 29%. Sometimes more is not better. Headaches, flushing, upset stomach, and stuffy nose are some of the most common side effects. Compared to sildenafil 50 milligrams, tadalafil 10 milligrams had a decreased overall rate of side effects. The greatest pick is the one that fits your physique, your meal pattern, your timing, and your tolerance. And for a lot of people over 60, the best secret weapon is a regular routine with a clever, scheduled booster that your doctor tells you to take, along with the meal timing rule. Let's talk about independence, because that's what this is actually about. Every day of confident activity after age 60 helps keep balance. Walking is safe when you have balance. Walking is good for your head, heart, and the people you love. When intimacy gets better, people frequently feel better and are more motivated. You move around more. You get involved more. You get better sleep. It's a good loop. If you make a few thoughtful changes today, you won't end yourself in a routine where you have to sit in a chair all the time. That's the deeper reason. It's not too late. If you hear a voice in your head telling you that you missed your chance, I'm here to calm it down. Your body still reacts. Your blood vessels still pay attention. They might just need a better plan. We're not after young people. We're helping you live your life now with less stress and more ease. A few useful tips that benefit a lot of seniors. Set a reminder for the routine you choose so that it happens at the same time every day. Keep a small water bottle close by. Staying hydrated helps blood flow. Go for a walk most days. Even a short walk of 10 to 15 minutes can enhance blood flow in general. Keep sleep safe. A brain that has had enough rest delivers a better signal. Be honest with your partner. A calm, kind start makes things less stressful. Quick answers to common questions. Is it okay to switch pills? Yes, but only with your doctor's help. Bring your log so the switch knows what to do. What if I get a headache? Tell your doctor. A little tweak in dosage or a new choice can help sometimes. What if I have high blood pressure or diabetes? Many of the males in the studies had the same problems. The most important thing is to work with your doctor and pay attention to when you eat, when you take your medicine, and any side effects you could have. How long should I stick with a plan? Try it a few times in a row. Keep the conditions the same so you can compare like with like. Do I have to take a pill every day? Not always. Some men stick to the same habits for a while and then change them. Your needs might vary. You can also change your plan. A gentle warning in simple words before we finish. This movie is for learning. This isn't medical advice for you. Your health history is important. Please work with your personal doctor to decide on drugs, when to take them, and how much to take. Let's go over your 5-step action plan one last time in a short and basic way. 1. Make sure it's safe. No nitrates. Heart ready for sex. List of all medications. 2. Pick your fit. Quick on-demand time frame or more time to plan. 3. Start with doses that are based on evidence. Don't eat large meals close. Keep the booze light. 4. Keep track using a basic log. Change one thing at a time. 5. If you need to, follow your doctor's advice and use the steady-state strategy with a timed booster. If this makes sense to you, put 1 in the comments. If not, type 0. Your comments helps other people learn without feeling alone. And if you want to know what's next in this series, keep reading. We'll talk about mild, senior-friendly pelvic floor behaviors and morning rituals that might help with circulation and confidence. Keep this in mind for today. You can mend silent mistakes. You can help blood flow, maintain your independence, and feel more like yourself with only a few modest modifications. You might not even realize how much better life can feel. That work is worth it for you.